Hello friends, welcome back. In today's lecture I would like to update the antibiotics for high risk febrile neutropenia patients with cancer. As a monotherapy, cefepime is preferred or recommended by the Infectious Disease Society of America. You can also use zosyn, which is piperacillin with tazobactam. Both zosyn and cefepime has anti-pseudomonal coverage. Now, if you're considering a little stronger antibiotic than carbapenems, you can choose, for example, meropenem or polymyxin, which is imipenem with cilastatin. Now, if you're considering ceftazidime, which also has anti-pseudomonal coverage, just be aware that ceftazidime has a weaker gram-positive coverage, and there is a potential for breakthrough infection. If the patient is at the risk of having drug-resistant bacteria like MRSA or VRE or ViSA or KPC or ESBL producing gram-negative bacteria, then combination therapy may be needed. Now look at the patient. If the patient has any previous history of MRSA infection or patient has the risk factor for developing MRSA, then initiating early either with vancomycin or linezolid or daptomycin would be appropriate. If the patient has risk factor for VRE, that is Vanco resistant enterococcus, then initiating early with either linezolid or daptomycin is recommended. For ESBL producing bacteria, initiating early with carbapenems is recommended. If the patient has risk factor for KPC, carbapenems producing Klebsiella, then early either polymyxin or colistin would be appropriate. Just if you can memorize, note down this slide somewhere, because it gives you name of the bacteria and the antibiotic which can be used to kill those bacteria. But the thing is, sometime empirical therapy is not advisable for treating febrile episodes in cancerous neutropenic patient, because empiric means presumptive, which is not confirmed yet. So, and if you're using antibiotic for several days or weeks, that can sometimes lead to accumulation of antibiotic. For example, aminoglycoside, if you're giving for 5 to 10 days, for treatment, they can start accumulating. Just be aware of these facts, and therefore, sometime if you have to, you need to get the ID consult, get the consult and provide the best care to your patients. Thank you.